Okay, good morning everybody, and welcome to what I hope is our first part of a live broadcast for the Find a Cure's virtual rare disease showcase. Really excited to be doing this today and to welcome all of you to our online platform of SWOT and to see what the next 3 days are going to bring. It's going to be an exciting event and also quite a new one for us. Clearly, this is a product of a huge amount of hard work on the part of the team at Find a Cure, but also a huge range of speakers and helpers who've been helping to put this program together. So I'll take this opportunity right at the start to thank all of you who are involved here and now. And it's also obviously the product of a very strange year, a year where we've had a global pandemic, which has really led to 2020 not being what anyone expected. Regardless of that, though, it is important to note that we're all here for rare diseases, and that challenge of rare diseases hasn't gone away because of COVID-19. It's still present, and everyone here is still hopefully trying to find ways to push forward work in the rare disease space to make a big difference to the people in that community. Rare diseases, it's easy to imagine they don't affect many people because of that rare tag, but obviously this isn't the case. If you collect all rare conditions together, they're affecting around 3.5 million people in the UK, or 350 million people worldwide, which is a really sizable chunk of that population. There are over 7,000 different conditions, and this means that, people experience their condition in very different ways. There's very, very different biological symptoms, but all of these people are united by, in many ways, a very common experience of the disease itself. Challenges of diagnosis, challenges in receiving support care, and obviously challenges in receiving the treatments that they require. And this commonality leads to a very common theme that we see across the rare disease space, which is that we have an informed patient population who are really determined and have great power to deliver change for themselves and make a difference. And it's that determination to deliver change which hopefully unites us all in today's showcase and the work we begin doing over the next few days. So I want to welcome you and thank you for attending. Our showcases are all about trying to connect people together. As you can see from pictures from our previous events, they tend to be face-to-face, but that won't alter things this time. We want to make sure you get a chance to speak to people, to hear exciting talks, and to really highlight and showcase what's going on in the rare disease world. The simplest way to get started is actually to introduce the Find a Cure team, the people behind the scenes who have put this together and are hopefully going to make it a really exciting event for you. So my name is Rick. I'm CEO of Find a Cure, and I've been in charge of the organisation for, well, 3.5 years plus now. And I'll be involved in a fair few sessions. You'll be seeing a bit too much of me over the next 3 days. I'm joined today by Mary Rose Roberts, who is our head of operations. Hi, Mary Rose. So she is not going to be seen too much on the front end, but be sure she's been working behind the scenes at a crazy rate to make sure everything stays live and active. So thanks for all your work already, Mary Rose. Along with us today, we also have Laura Thompson-Harper. This is Laura, who is our fundraising manager. She's been with us since last November, doing a fantastic job keeping things ticking over. So if you want to, if you're really impressed and want to support Find a Cure on our mission, make sure you contact Laura straight away. The newest member of the team who's also with us today is Blaine Baker. So Blaine joined just over 4 months ago and is our marketing and engagement manager. And finally, we have Philippa Norman, Phil, who's our newly promoted project coordinator, who's going to be helping me with quite a lot of the hosting duties and also now diving in and introducing us to Find a Cure and the work that we do. So Phil, take it away.
Hello everyone, it's so nice to be here in this virtual environment today, and I'm so happy that over the next few days we're going to really dive into some interesting themes, and I'm so excited to be hosting with some really interesting speakers as well. So Find a Cure, if you're not familiar with us, are a charity that kind of has a mission of a world in which all rare diseases have treatments made together with patients for patients. So we really see collaborations with patients at the heart of what we do and with the whole rare disease community, as hopefully will be kind of shown to you in this rare disease showcase that's happening this week. Next slide, Rick. Thank you. So you might be saying to yourself, but what do you do? So mainly we do our empowerment program, which is patient group training centered around workshops, webinars, our peer mentoring program, and our e-learning portal. And we want to help patient organisations to build and grow. We want them to be able to support their patients and the families, and we want to get them ready for research so that they can hopefully really find treatments for themselves and really feel empowered to do that. And ultimately, we want them to raise awareness so that people understand what it's actually like to live with a rare condition. And part of that is our Uniting Communities focus. And this is what the showcase falls into. So we aim to build a unified community of rare disease patients, researchers and advocates. So hopefully you'll have a chance to network with people from all across the rare disease community on the platform this week. And as part of that as well, we run our Student Voice Prize, which actually ended yesterday and is looking very successful this year. And also our Rare Chat series. So if you're interested in any of those, you can just head to our website after the showcase and have a look at those as well.
Awesome, thanks, Phil. And yeah, I think it's really important just to stress everything we're doing, whether we divide it into different sessions or not, is about trying to build a unified rare disease community and helping patient groups, industry, academics, researchers to learn from each other and share their experiences. It's not easy to do stuff in the rare disease space, but if we can work together and build that kind of cross-cutting community, then hopefully we can do a lot more and be more successful. And that really is kind of the crux of what the showcases are and have been about. We're trying to do two major things. Firstly, highlight excellence in rare disease work that's going on around the UK, or more actively now around the world. But also it really is about creating opportunities for the people who come to our event. We want to create opportunities for you guys to meet new people and meet people outside of your field. We want to create opportunities for you to share your work with an interested audience, which might be through giving a delegate proposed lightning talk, or might be just through making that interaction and connection on the day. And in doing this, we're creating opportunities for that community to build, to grow, and to strengthen its connections. And that's what the showcase is for. Because of this, we have a really diverse audience, at least with the type of work and background that everyone's taking part in. Throughout the showcase, you will meet people definitely from patient groups or patients with rare diseases themselves, but you'll be seeing people who work in the pharmaceutical industry, academic researchers, clinicians who are dealing with rare disease patients on a daily basis, people who've set up and working in biotech companies, and a whole range of different people in other life sciences and support services who can actually help the work move forward in the rare disease sector. We really believe that if all of you guys are working together, then we're going to be in a position where we can improve patient care and deliver more effective treatments for the rare disease space. So please, chat to each other and let's make some new collaborations happen. So where do showcases normally happen? What's been the past? Well, we started back in 2015 with a tiny little networking event in our hometown in Cambridge, and it's kind of grown from there. We've tried to run annual events in Cambridge every year, and obviously this year things have gone a bit sideways on that one. But since then, we've also hopping around the UK, going to deliver larger live events in different locations. So we've been to Birmingham, we then went on to Cardiff, Newcastle, finally made it to Scotland in Glasgow in 2018, and then last year in October we hit Manchester, which was the biggest showcase event to date and something we really enjoyed. And then we hit a problem like 2020. How do you solve a problem like 2020? That is a bit beyond me, but what we've had to do is find a way to try and ensure we can have an event that lets you guys talk to each other, to hear stories and showcase what's happening in the rare space. And what we've tried to do with the virtual rare disease showcase is build a dedicated online event. We want to try and give people different ways to engage with each other. Some of you might just want to sit back and listen to people like me talk, and you've got plenty of webinars you can attend and have a really great time listening to some interesting talks throughout the next 3 days. We've tried to set up ways for you to have interactive discussions so you can work carefully and interact with one another to share your opinions. And also, using this platform, you have the chance to have one-on-one chats or video meetings with people you want to talk to. We've tried to build something that's easy to navigate and really define clear content so you know which things are interesting to you, so you can come along and attend it. And fundamentally, everything over the next few days is about the fact that the virtual world has become dominant to us. And what does that actually mean for rare diseases, and how do we go about implementing change and making a difference in that virtual space? And you're going to hear a huge range of talks that are touching on different areas that deal with just that question. And that gives us our showcase on the platform swap card. And hopefully you've all seen and are very familiar with this screen I'm showing you now, because you had to press it to get to this talk. We hope this platform is easy to navigate and gives you a chance to discover new things about rare diseases, to discuss rare diseases and the work you're doing with different people, and to find new ways to engage with that community. And at very least, you should get on social media right now and share your thoughts on the work with our hashtag Rare Showcase 2020. So I'm going to take you a bit through the agenda now. What can you expect over the next 3 days? Well, firstly, today, after you've finished listening to me, we're going to dive into our first theme, which is the unprecedented challenge we're facing right now, the impact of COVID-19 on rare diseases. And what you're going to see here is that we've tried to lay the event out in a really simple way. So every theme will happen either in the morning or afternoon, and in each one, there'll be a 90-minute webinar, which is a series of talks looking at the topics on that theme. And following that, there are 3 different parallel breakout sessions for you to choose from on our platform. And these are designed to be far more interactive, to drop you into a Zoom room where you can talk to people and share your thoughts and opinions. So have a check out there. After this morning, we'll be moving on to the afternoon, where we're looking at telemedicine and the impact it's having on the rare disease space. And you can see, again, a huge range of talks there. And I'd just like to draw your attention to the first of 3 lightning talk sessions here. Our lightning talks are something we've been doing at Find a Cure for a number of years, and these are delegate proposed talks to give you guys a chance to share your stories and your work with our diverse audience. So during a lightning talk session, we'll have, I believe, 5 speakers taking the stage for 5 minutes, trying to beat the infamous Find a Cure bell and share their thoughts and opinions on the work they've been doing. So please do check that out and support those people taking the stage later today. Tomorrow morning, we'll be looking at the technological revolution and really trying to understand how technology is changing the way we're approaching rare diseases and then helping to break barriers in the rare disease pathway. So in particular, looking at ways that we're using technology to transform our approach to diagnostics, to transform the way we're identifying new drugs, and hopefully to transform the engagement of patients with clinical trials and helping to bring them into the development pathway. In the afternoon, we're going to look much more at the opportunities the digital space is creating to build communities and find ways to bring different people from different backgrounds into that rare disease community and really strengthen that unity. So we'll be studying ways to interact with the youth side of things, but also increasing the diversity of the rare disease space. And on day 3, on Thursday, we're going to have that bigger research focus. So we'll be looking initially at the value of real-world evidence in rare diseases and how it's driving things forward. Before then, we move on to look at how we're going to have to re-envisage the clinical trials landscape after COVID-19. And we'll wrap the whole thing up with a little plenary talk, which will be given by our 2 founders, Nick Serow and Tony Hall, talking about Find a Cure in the past, present and future. So please do hang around to hear about that and get a bit of a sense of what we're doing at the charity moving forward. So this sounds great. How do I actually access this wonderful wealth of content? Well, you use Swapcard and everything is really straightforward. Across the top of your screens, you see a very simple menu that tells you all the things you need to do. Right now, you are hopefully watching me on the live session Watch Now, which you can see highlighted here. And in this little box, you should see my face, which is a beautiful thing to behold alongside the PowerPoint slides themselves. If you feel like you want to go somewhere else, you can click somewhere else and that video should follow you, so you can always access our live webinars on the main stage at any point during using the platform. You can also interact directly with us by submitting questions or chatting to one another in the chat function alongside it. So please do engage with each other that way. Questions will be fed to the speakers who will be able to hopefully have periods to interact with them and engage with them during the webinars later on today. If you want to see what's going on later, then just press the agenda tab and that will give you an insight into what's happening further on in the showcase program. What you'll see here is all of the talks are organised by the day, and you can select the day you want to look at to easily find what's going on, and those are arranged chronologically as you move through the platform itself. Next to each of the talks, you'll see a little calendar icon. If you press this, you'll add it to your own personal schedule, which will mean it will appear on the right-hand side here on your agenda screen or turn up in your My Schedule space. So you can really look in detail and see what's going on and happening for you during the showcase. But remember, not all of our sessions are available to everybody. There are limited seats in a number of the breakouts, which you can see recorded in the screen text here. So you need to try and register for those sessions to make sure you get a spot and can engage nicely with our live audience. To do that, you just click on that session. It will take you to a screen that tells you all about the breakout itself, and you will see a nice register button here and a number of seats left here. So please go register for things you want to do and make sure you engage with it. When the sessions go live, you'll be able to press the joining button here to join that panel, and that will give you a link to take you straight into a Zoom room. And this is the whole point of these sessions. You're going to be in the session. We're going to have interactivity. We want you to get those cameras on and hopefully get your opinions out and really share your thoughts. We want to make sure you feel that you're talking to people during the next 3 days. You can also join these sessions if you've registered through your notifications. So at the top of your Swapcard platform, you'll see a little bell. Here you'll be notified of anything major that's happening. and you'll receive a link to any session that you've registered through using that little function. Make sure you speak directly to those speakers because we're having questions live in there rather than through the chat function. So do be prepared to share your thoughts and questions with them. So it's not just about listening to talks, it's not just about talking to each other, it is about finding other ways for you to engage with each other off program, and we think SwapCard's pretty good to help us do that. You can go in and try and find people to connect with. If you look at our attendees menu or our speakers menu, you'll find information about everyone who's here on the platform. You can connect with them and add them to your people menu, indicated by this little head icon at the top of the screen there. And anyone in there at the end of the event, you'll be able to download their details onto your personal records, so it's not locked away in SwapCard permanently. From there, you'll be able to have text chats with individuals, and you have a little chat menu indicated by these little speech bubbles here, where you can talk directly to people using text chat or arrange to organize one-on-one live video meetings within SwapCard itself. So do try that out. You can do the same thing with any of our exhibitors. So check out our exhibition stands, which have a range of different charities and organizations who want to share information with you. They all have their own chat channel, and they all have meeting slots where you can try and interact with them and talk to them one-on-one. If you're feeling a bit less sure about diving into that kind of world of digital networking and direct chat, go to our discussion boards. We try to put a few questions up there for you to answer. Introduce yourself, share your opinions, and hopefully find someone else that you want to talk to about one of these topics and go from there. So please do interact with those and make the effort to have a look at some stage during the next 3 days. Not satisfied with all these things, we thought we should try and run some actual networking sessions as well. So at lunchtime today, around 1 o'clock, we'll be having a little round table discussion, which is hosted by a friend of FindACure, Tarquin Bennett-Coles, and he'll be giving us some insights into how to make the most of digital networking. So do attend that for some tips. And then following on from this, on the lunches on Wednesday and Thursday, we'll have some speed networking sessions. So recommend you sign up for that and get thrown into some interesting rooms and have a chat with some people that you wouldn't otherwise have talked to. And this can only be a good thing for you and your organization. So finally, if in doubt, there is information on this platform to help you know how to make it work. If you just press the resources tab, you'll see a whole range of different information that's been shared by our exhibitors and FindACure to help. And you can use a search function and search for our delegate pack, where you can see the nice visual breakdown of our program, or the user guidance to give you more tips and hints on how to make the most of SwapCard itself. But really, this event is all about getting stuck in, so try your best to make the most of what's here. We've all been stuck indoors in our houses for many months now, and we want different chances to talk to some different people. So we're hoping we're providing you with that. Please make the most of it, and please engage to help us make this not just the largest event we've ever run, with a scary number of more than 350 people registered, but hopefully the most engaged and successful, and that really is down to you guys. So the final thing for me to do is to thank our sponsors and the people who've helped to fund this event and make it possible to host 350 of you on a free ticket, which I'm really excited about. Our headline sponsor, Barnacle EMAS, have been really supportive of the showcase for a number of years now and got behind this showcase even before we heard of COVID-19 and have supported us right through the transition into a virtual space. So thank you to them, and also to our corporate partner for the year, Helex, who's similarly been working with FindACure for a while. And I'm also really pleased to say for the first time we've secured National Lottery funding from the Community Fund to support the showcase and our Uniting Communities work. So a big thank you to them for backing us and believing in the impact of this event. Since we've been launching this as a virtual program, we've also been backed by a number of companies who've come as theme sponsors, and I want to make a big thank you to them. So Roche, I'll be sponsoring and supporting our Theme 1, the impact of COVID-19. Theme 4 has been supported by Open Health, looking at the ways we can build digital communities. And finally, Theme 5, Real World Evidence, supported by Aparito. So thank you to all of you guys for your support. And that is pretty much all I have to say on our welcome. And I'm fiendishly well timed, which makes me very happy. So I'd like to thank you for your attention. Please do dive in, engage with everything that's going on today. And we're excited to see what happens. That's the conclusion of my welcome. And now what I suggest is you all hop from the live thread, go over to the COVID-19 theme and join that webinar, and you will see me once more introducing you to a panel of excellent speakers, and we'll see what they all have to say about the impact of COVID-19 on rare diseases. Thank you so much for your time. Hello again, welcome back, long time no see. Welcome to our first webinar session for the Virtual Rare Disease Showcase. This is our theme, all about the impact of COVID-19 on rare diseases. We thought, let's not have an elephant in the room. Let's just dive straight in and talk about the thing that's been impacting all of our lives extremely significantly over the last year. And the first thing for me to do is just to quickly thank, once again, our theme sponsor, Roche, for coming in and supporting the work we're doing on this event. So I'm going to stop sharing my screen now and dive into our main room and give you a bit of information on what we're trying to do and look at on COVID-19. So it's really hard to understate the impact that COVID has had on the whole world during this year. But it's fair to say that rare disease patients have faced a really interesting challenge and a unique challenge going forward. The impact that we've seen across the sector has been quite broad, whether that's simply on the ability for patient groups and charities to easily secure funding and maintain their operations, whether it's been the increased burden on those patient organisations to provide support for the patient community who are uncertain about how to move forward. The challenges we've seen in drug development and maintaining the drive through in clinical trials and research, the difficulty in actually accessing healthcare and feeling confident and safe and secure that you can go to hospital if you're having a major issue. It's just been a truly complex situation, and what we've been witnessing over the last year is lots of different groups and organizations trying to find a way to move forward and still delivering a huge amount of impact and successful results for the community. So this session is all about trying to dive into that, to initially look at the impact on individuals and patient groups within that rare disease space, to then look more broadly at the impact of COVID-19 on the broad rare disease community, which includes industry, academics and researchers. And then finally to focus in a bit more depth on the role of drug repurposing in both driving forward COVID research and COVID treatments, but how we can draw hope and inspiration from that for the rare disease space itself. So I'm really excited to hear what everyone's got to say for this session. And our first speaker in this, you'll be pleased to know, is not me. We decided we want to put the patients right up front within this session. And so I'm really pleased to welcome Lara Bloom, which I think is the first time Lara's spoken at a Find a Cure event, which I'm really chuffed to have her here. So Lara is, well, I'm sure, as you all know, the CEO of the Ehlers-Danlos Society, and has been doing a huge amount of work in this area for a number of years now, and I think recently made a professor of patient engagement, which is a really exciting thing to see. Lara's going to be sharing with us her personal experience of rare disease during COVID-19, which does include COVID-19, and also the experience of the patient group that she works with and how they've been trying to move things forward during this period. So Lara, welcome. Thank you so much for being here, and I'm really excited to hear what you've got to say.
Thank you so much, Rick, and thank you to Find a Cure for this opportunity. So I'm going to share my screen. That Zoom moment where everyone holds their breath. Hopefully you can see. Yes, great. Okay, so adapting to life in a global pandemic, it's something that everyone has had to do, not least of all those living with rare and chronic health conditions. I think at the beginning of this year, we all saw COVID-19 as something we'd have to fight through for 3 to 6 months, and we'd all come out the other end stronger. And we're now realizing just how long-term this is, how we're going to feel the effects of this for many years, and if not generations. And I don't think life will ever go back to what it was and finding a new normal. And so, of course, with that, nonprofits, and we are a global international organization, we're having to work in lots of different countries with lots of different lockdowns, lots of different restrictions and impacts on people. But really, we're finding that the same themes are coming out everywhere. So at the beginning of this year, when the world entered this period, I actually started the beginning of the year and at the end of January and February doing a cycle challenge across Cambodia and Vietnam. And so I was really in an area that was much closely impacted than we were at the beginning of the year. And so there was a sense of us all, rushing home and getting back to the safety of the US and the UK, and really being very naive as to what really was to come. And I'd been back about a month. So what happened had no result on me actually being in those areas. It was around the 16th of March when I started feeling unwell. And I have, with my EDS, I live with Ehlers-Danlos syndrome. I have 2 immune deficiencies, and one of those gives me an increased risk of getting pneumonia. And so anything to do with the chest or breathing, I'm always very susceptible to catching. And so it was no real surprise when I actually got COVID-19. And March the 23rd, after a couple of weeks of becoming more and more unwell, I was taken into hospital, and I'd actually also developed pneumonia on my right lung. And it was really frightening because it was right at the beginning of everything. It was when you had to wait hours for an ambulance. I was taken in by ambulance eventually, and lined up in a corridor on beds that, you're kind of, it was like being in a war setting where you're coming round and they're assessing whether you are too ill to, stand, sit, or be in a bed. And then they assess how you'll be, taken into that ward. And the day that I was taken in was actually the day when all the PPE was delivered to that hospital, and watching all the nurses and doctors kind of helping each other work out how to use the PPE. It was like witnessing a documentary or a film, and it felt very unreal. And I think I was blown away by everyone and the level of care. It was also incredibly scary. As I was there was a doctor having his temperature taken, and I could hear how ill he was. And within an hour of me being there, he had been sent home. So it was really seeing the very, very harsh reality of this, and feeling like you're on a conveyor belt of people being impacted by this. I'm pleased to say that I recovered well, and it took a couple of months, and I was what they call virtually admitted. So I had lots of regular calls from the hospital, and I just think, considering what the stress that they were under and how everyone was adapting day by day, I can't fault the level of care that I got. I have had follow-up scans to check if there's any kind of lasting long COVID that we're seeing. I definitely don't think that I'm back to the full strength I was. I do feel fatigued more easily, but I'm pleased to say that there's nothing that's showing on my lungs or my cardiac scans to show that there's any impact there. So during all of this, with me personally being very unwell, I was leading an organization that was caring for a community that were also very fearful of how this would impact them. So what did we do at the Ehlers-Danlos Society? We care for people living with EDS, hypermobility spectrum disorders, and all the comorbidities that come with it. And those comorbidities include mast cell, fatigue, immune deficiencies, and things that we knew could really be impacted from this pandemic. So March the 16th, the same day that I began getting really ill, saw the launch of our COVID-19 webpage. We realized very quickly how many increased questions we were getting on our helpline, on our social media, and how much unknown there was. And so we really kind of led the way in the nonprofit space of having a dedicated page for COVID, giving the latest updates that we could find from the CDC, from the WHO, from any publications that were coming out very, very quickly, things that were being announced on the news, just giving the EDS and HSD community one place where they could go and find all of that information. And we had over 18,000 first-time visits in the first 2 weeks. So it demonstrates what a huge need there was for this information, and some sort of comfort that the organization that they turned to was somewhere that they could go to find out what was going on. We have always run virtual support calls. We lived in a virtual landscape long before COVID-19. We have nearly 20 members of staff from all over the world, and we've never had bricks and mortar. We prefer for as much funding to go into our mission as possible. So Zoom for us, we were pros before this even began. And we were pros in the sense of the resources we supported. So we were one of the first organizations to do virtual support calls. But what we did when this happened is we increased them. So we went even more global in our time zones. We did things at the weekends and the evenings. Our team were just phenomenal and just worked day and night to give the support. And we really, we had 30 to 50 people dialing in to each virtual meeting. And the only thing people wanted to talk about was COVID. You know, it was really a place where people could come, be safe, feel that they were in a safe space to talk about their fears and their concerns. And since then, we're still running more support calls than we ever have. And we've kept to those different time zones, and we're still seeing them more highly attended this time this year than we did last year. So I think that it's showing that that support needs to continue. We also realised, you know, and we know how important movement is for people living with EDS and HSD. Deconditioning can completely change someone's quality of life. And so often that's done in a supportive therapeutic way. So physical therapy, hydrotherapy, and you know, occupational therapy, and so on. So we're very, very proud to facilitate the work of the International Consortium for EDS and HSD. And we have on that consortium a committee for every type of EDS and a working group for all the comorbidities. And we have an allied health working group that covers all of the different therapeutics that there are out there and people from all over the world. And we turned to them and we said, help. We need to create a movement series that people can access online. And it was unbelievable how quickly people came together for free in their own time, putting together videos, resources for adults, kids and teens. And it really, we just saw such a huge uptake of people watching those and then realizing that our community need that all the time. So, you know, as each challenge presented itself, it was also an opportunity to see what we could do long term, not just during this pandemic. So this is something we're really going to work on. People can't always access the therapies that they need and deserve, either due to geography or wealth. That's still a reality. So we need to provide something when that doesn't work. Ask the helpline. So we run a free helpline globally, so people can call up from wherever they are in the world for free. And we also have an email helpline. Some people prefer not to talk to people. So we saw a marked increase in the Ask the Helpline, and we still continue to say we're here when you need us. Definitely the COVID questions have got less since the first part of this year, but they're still there. And as each new discovery, you know, the vaccine conversation, you see then an increase again in COVID related questions. So how did we adapt? You know, we run in-person events all the time. In fact, in 2019, I was in a different country every week, and that's no exaggeration, either attending conferences to talk about the work we're doing or to host our own virtual events. Exactly today, a year ago, we were in Tokyo holding a conference on the rare types of EDS. So we got around, and that was a huge part of our mission. So how did we still reach the same people, if not more, in this virtual way? And we were one of the first organizations that put together a really huge virtual event. We did it on Zoom. Our target was 250 attendees, and we smashed that out the park with 1,600 attendees from 41 different countries. And we did live translations into 5 different languages, including Arabic. We only had 3 people dial in listening to Arabic, but we didn't want this to just be for that moment. We wanted to build our resources long term. We know that there's almost nothing translated for EDS and HSD into Arabic. So saw this as a real opportunity to increase those resources and give people in those Arabic speaking countries something that they can turn to in the future. And this changed our plans for our events. 2021 is going to be a completely virtual year for the first time ever. And we're really excited to learn from this and to ensure that even when we are back to in-person events, which we still see as an important thing, we're still doing a virtual component of it, still doing the live streaming, still doing the translations and the captioning, because we're going to reach more people than ever that way. And I think that you're seeing nonprofits realizing that and adapting to that very, very quickly. We also launched around June, I believe, a COVID-19 survey. So we wanted to see really how are people being affected with EDS and HSD? Is there an increase in people catching this? Is it actually not a higher risk factor? And aside from the actual, you know, virus itself, what are the other implications? So we surveyed in total 1,343 people. And this was the percentage of people who had WHO risk factors associated with more severe COVID-19 disease. And you can see they're not high numbers. I think the highest is 37% with unrelated lung disease and 20% a form of immunosuppression. So this was interesting to see that actually we're not talking about large numbers, but this was very, very helpful for us to understand that. We also looked at the proportion of the group reporting pre-COVID-19 pandemic comorbidities. So you can see here, these are high. You know, the ones that I talked about, musculoskeletal pain, GI concerns, psychological disorders, mobility, anxiety, bladder, fatigue, depression, mast cells, sleep, dysautonomia, headache, breathing concerns. EDS comes with a really wide spectrum of symptoms and conditions that can go alongside. And you can see that this is quite consistent throughout the people that we surveyed. And so how many people actually got COVID-19 or the symptoms? You can see the large proportion is nothing, no symptoms. Then we had the next section was symptoms but tested negative, symptoms but didn't test, and a very small percentage of positive tests and some with an inconclusive test. So that again told us that the reality of this is the impact for EDS and HSD is not the virus itself, it's everything else that comes from the virus. How are people managing their symptoms? So this is specifically the COVID-19 symptoms for those that did have it. And you can see again, the large proportion of people were at home. We had a very small percentage admitted to ICU. Some, the second largest was ER, A&E, and then home, and then a smaller percentage with hospital admission. So again, that similar story that even when people did catch it, largely they were being able to manage it at home and not getting severely ill as a consequence. And this was interesting as well, the level of distancing. So there was real confusion as to who should be self-isolating and really preventing themselves from having any contact even after lockdown finished in the UK, for example, in June. And EDS itself was not seen as a reason to shield. Someone like me, for example, was asked to shield because I have immune deficiencies. So I think the comorbidities really changed whether people would need to make that decision. And you can see here about half just distance based on the country general guidelines. The next largest percentage was self-isolation by choice because they were worried and they didn't feel that there was enough known whether they were at higher risk. And the smallest percentage were those that were told that they needed to shield because of a direct risk of becoming iller. So it really was, we did see that most people weren't what we call in the UK shielding. But you can see here a large percentage of people were impacted in their access to care. And 2/3 of the group experienced tests being postponed. And that has a huge impact in quality of life and how people were experiencing their symptoms. And then there was, you know, whether that access to care was over fear. So 2/3 of the group expressed concern over exposure to COVID by attending routine care appointments. Huge amount of them were really, really worried about even if they could go, whether they should go. And so that's going to take a long time as well for people to have the confidence that they can go and not put themselves at more risk, but then also balancing that with, is there actually an increased risk for this population? From what we're seeing from this survey, not that we can see. And then there was, of course, access to care in the sense of fear and seeking emergency care because of the risk of exposure. And so I'm pleased to say that most people were not fearful and still felt that they would go to emergency if they had something unrelated to COVID. But still 1/3 of group did express concern over that exposure risk, which is, I think, 1/3 too many. And then this is, you know, I think the most troubling, that the access to care in terms of disruption to services. You know, 3/4 of the group reported disruptions to clinic services and just over half to physical therapy, which is so essential in quality of life. Clinics, therapists, mental health services, pharmacy and equipment supplies, a real disruption in that access. And disruption to treatment. So again, half of the group found no disruption, but 25% reported disruption to medications and special diets needed in the management of their condition. So this was a bit more comforting to see that half didn't experience that, but you know, still there is another half there that did. And then impact on well-being, you know, such an important part of this. And you can see here that there were people that reported severe and a small percent was mild and no effect. But half the group considered disruptions to the service did have a moderate to severe impact on their well-being. And you can see here that 2/3 of those with depression reported that their depression was somewhat or much worse. And I think that we're seeing this not just in the rare and chronic health community, but we're seeing a real increase in suicides. And I think that this is going to be, unfortunately, one of the huge negatives that comes out of this period of self-isolation, shielding, distancing, businesses being closed. And I think that we need to be very mindful of that. Something else I want to touch on is long COVID. We're suddenly seeing a real increase in funding and acknowledgement and validation of these symptoms that come with long COVID. And let's face it, people certainly with EDS and HSD and often with rare and chronic conditions have been living with these symptoms for years, for their whole life. And this has been such an underfunded and underrepresented area in terms of research and progression. And I hope that what comes from this is that people pay more attention to this, and not just through the COVID lens, but through fibromyalgia, ME, lupus, EDS, HSD, and everything else in between that comes with exactly the same symptoms that are so life impacting. I think the other thing to bear in mind as well is that, people who have lived with a rare and chronic disease have had some kind of self-isolation their whole lives. They can't work, they can't go to school, they can't see loved ones because they're stuck at home, because they are in pain, and because they have very real physical issues that prevent them from leading a normal life. And suddenly the world is on the same page as them. And I hope and pray that after this, those living with no conditions, those that are healthy in body and mind, remember how it felt this year and have that empathy and sympathy for those that this is normal everyday life. And I hope that we all learn a lot from that and become kinder people to these communities, because it is so important. It really is. And the other thing I want to touch on is that, we're not just talking about rare and chronic diseases. We are talking about the fact that every area is impacted. Unfortunately, 2 months ago, we lost a baby, and my wife was very seriously ill and nearly lost her life. We had a ruptured ectopic pregnancy, and she was in hospital for 6 days. And for the entire period, I couldn't see her. I couldn't be with her. She had to experience everything on her own. And I too had to experience everything on my own, being stuck at home. And I think that these impacts people aren't thinking about as much. The fact I couldn't hold her hand through that. I couldn't be there when we lost that baby in that moment. And I think that everyone needs to be very mindful of all of the consequences and effects that are happening because of this really frightening condition, and to do everything that we can to support those that are impacted by this, not least in the rare and chronic disease space. So thank you very much for your attention. I am going to stop sharing now and pass back over to Rick. Thank you.
Lara, thank you so much. Brilliantly capturing both the personal impact and the challenges that this has highlighted for everybody in the community, but also the impacts for that your specific condition and the specific community. So I really appreciate that, and thank you for sharing those personal comments, particularly there. I'm really sorry for your loss there, but thank you for sharing that with us. I just wanted to ask a couple of brief questions, actually. I just wrote down before you did that, I wanted to ask you about the impact of the isolation on you personally, which I think actually you've now touched on, but possibly feeding on from that, I also wanted to think about the pressure that you may or may not have felt at the start of this epidemic, representing that broad global EDS community, and how helping them deal with and navigate the challenge of COVID, then having the condition on top of it. I just wondered how you cope with that and the different challenges you might have faced during that period and what impact it had on you.
Yeah, no, absolutely. I think, as a CEO living with the condition, there's always a real personal driving force for me, that it's always, you go back to, for me, most days I go back to the undiagnosed me and what that meant to me to keep moving on. And for this, it was very easy to then touch on how does it feel to have this and live with this condition. But there was also actually a real fear in whether I shared that I had this, because I think I didn't want to, I know that I have a large social media following, and I didn't want to share this and then everyone just assume, oh God, I knew it, we're more at risk, because that actually, my situation is quite unique in that sense, as we saw from the survey. And so I didn't announce it immediately, and also I had a lot of messages of people suddenly being really scared if something happened to me, that there wouldn't be, the support there. And my goodness, it takes a village. It's absolutely on me. We have an incredible team, and it ran beautifully when I went down. But there was, I think, a real sense and everyone just getting on calls and planning and all day and night on what do we do here. It's changing daily, and there was a real responsibility in doing the right thing, giving the right information. And I think, but in turn, there was a real grace from the community in knowing that if we made mistakes or if we gave the wrong information, everyone was in the same boat of learning and feeding off the information that we're getting day by day, and just incredibly grateful that we were creating one space, that they didn't have to go to the WHO, the CDC, the new social media, Facebook. We kind of brought it all together. So I think that was great, but it was a very trying time. And I think I have to say, though, that I'm so proud of us as an organization and all of our team, because we didn't just survive. I believe we really thrived through this challenge, and we'll come out stronger. And of course, there's ever the challenge of donations and sustaining an organization in this climate. It's a very, very real fear. But if you just keep adapting to what the community need, I truly believe that nonprofits will survive through this.
Yeah, absolutely. Thank you so much, Lara. Brilliant answer, and to what was a very tricky situation, really well navigated. So I'm going to move on to our next speaker now, but we may well come back and talk to you again a little bit later. So thank you for that. And our next speakers actually feed on beautifully from what Lara's been talking about. So back at the start of all this, I think there was a recognition that was going to be a huge impact on the rare disease space, the rare disease world, and it was important that we had an idea of how we can monitor what has changed to try and ensure we can pull it back and make sure there are people there monitoring what's happening to hold to account any loss of service that rare disease patients would suffer. And a group kind of came together naturally, organically, from a range of different organizations, charities, companies, who are all broadly concerned about the situation. And that's essentially been spearheaded by our next three speakers. So we have joining us today to talk about a collaboration under the name of Ardent, Lucy Mackay, who's CEO of Medics for Rare Diseases, Joe Balfour, who's in charge of Cambridge Rare Disease Network, and Rebecca Stewart from Revolution magazine. So these guys really led the charge to pull this collaboration together, to drive it forward, and to think about how we can monitor and understand the impact of COVID on the UK health system, the UK rare disease patients, and hopefully to begin to understand what the impact is and drive for some change in the future. So guys, thank you for all your work on this from me. Thank you for speaking about today, and I will let you dive in and introduce yourselves and the work you've been doing.
Hi everyone, I'm first up. So I'm Lucy Mackay. I'm the CEO of Medics for Rare Diseases, and one of the sort of people at the very beginning of Ardent, which stands for Action for Rare Disease Empowerment. And I'm one of the three sort of in the organising committee, as Rick said. Just before I get onto it, I just have to say thank you to Lara, who actually was the second speaker that we ever had when Medics for Rare Diseases was a small student society at medical school. And when she came to talk to us about EDS and related conditions, she left me tearful and inspired, and she's just done the same thing. So I just wanted to say thank you before moving on, for sharing everything that you've been through and everything amazingly that you've done this year despite that. So that said, Ardent. So thank you, Rick, for the introduction. And I also, like Rick said, just want to say that we represent, we're three of a large number of contributors to Ardent, many of whom I am sure are watching today. So before I go further, I want to say thank you to everyone who's contributed to the work that we've done. So we're a cross-sector group of individuals and organisations who are committed to improving the lives of those with rare diseases, and specifically protecting or guarding, lifting up the rare disease community during the pandemic and the wake of the pandemic, which will surely be felt for years to come. It is an open and collaborative group, and we're using our different experiences and skills and contacts to collate data that is already out there, that has already been either specifically asked for, like for example with the EDS survey just there, and also the Genetic Alliance survey, there's a COIN study, or data that we know is produced but we maybe need to go do some digging to find it. And aside from that, we also wanted to gather the very, very many case studies and articles that were coming out to do with rare disease and the pandemic. Because while each of these things individually is hugely important to the community it was produced for, we believe that by bringing all of this rare disease related information, data, articles, case studies together into one place for one report created by anyone from the rare disease community who wants to get involved, we can have a much more powerful voice. So yeah, so you'll remember back in March and April that a lot of these things went out. So we've been using interns, and we've had and our themes groups going out and getting this data. So I'm just going to share my screen now to show you where we are in that. So, oh, hang on, I've got the presentation up and now I'm going to share my screen. Here we go. Okay, so this is Ardent Action for Rare Disease Empowerment. And so in terms of where we are, we started with capturing the evidence, collating it. We did do some specific case studies and interviews. Well, we'll come on to it later. Some themes did a lot more than that. And we're at the point of creating theme reports. So we brought together our stakeholders and talked about the different areas that we felt that the rare disease community had been impacted most during the pandemic. And these were the 3/4 themes that really came up. So diagnostic delay, coordinated health and social care, access to treatment and productive research, and drug development. So these were the ones we sort of whittled down and created 3 themes from, and each one of us represents a co-lead of that theme, and we have a co-lead who works with us. So stakeholders included patients, patient groups, healthcare professionals, regulatory experts, trial sponsors. And the aim of this report in the end is to demonstrate how rare disease world has been excessively affected by the pandemic and the subsequent reactions to that pandemic, knowing that everyone has been affected by this, but because the impact of rare diseases can be so pervasive in someone's life that the impact on rare disease, people living with rare diseases, is in excess to others. And so we aim to influence the action plans for the individual nations that will be produced after the UK Rare Disease Framework has been published. And this current report is based on the collating of evidence from pre-September. So what's really important is that having, once we've completed this, it's an experiment that we will repeat again. It's a process we will repeat again. And some data for this year will only come out next year, for example. So we're constantly keeping an eye on what's being published. And so importantly, hopefully, once COVID-19 feels like history, we will then have the infrastructure to continue bringing all of these groups, umbrella groups, patient groups, different people across different sectors together in order to work together for the empowerment of rare disease. So that's the Ardent as a concept, and what we are doing and what we've been doing for the last few months. And I'm the co-theme lead for diagnostic delay, which is theme 1. And I think what's really important about our initial findings is you've got to think that context is key for diagnostic delay. So in terms of diagnostic delay, the old normal, if we're going to talk about the new normal, was an odyssey already. So we all, as I'm sure the majority of people here know, so it was already a drawn out process, often involving many appointments, many different clinicians, lots of diagnostic tests. And so we're looking at, is there an exacerbation of this thanks to the pandemic? We would love to solve the diagnostic odyssey today, but this is more about how has the pandemic exacerbated that. So we whittled, so my theme, we whittled it down to some areas of focus, which are essentially hotspots along the diagnostic process, where by talking to people, we felt that there was change as a result of the pandemic. So pre-engagement. I think that pre-engagement, the evidence on this and the data on how pre-engagement has been affected will be coming out for years. So this is before anyone even goes towards a healthcare situation or tries to be wants to be assessed or tries to make a GP appointment. And if you think about that early messaging, it was stay at home, save lives, protect the NHS. And evidence out there goes to show that that's exactly what the public did. We're talking about massive drop-offs in A&E attendances. And then we've also got that pre-engagement situation where people were no longer mixing in their communities. So if you think that you've got some new parents and they've got a child who isn't having their face-to-face health worker come over to see their child, and they're also not going to a baby group, and they're also not seeing their family, the opportunities for that sort of external contribution or guidance for people is different. And the same for adult patients. That is well known within medicine that often the reason that people end up actually going to seek healthcare is because they've been told to by someone they care about has told them to go. So this pre-engagement and what happens to make someone go and access healthcare is an interesting part. And early years services within that, as in terms of those sort of those health visitor appointments, etc., and sort of when you go to a drop-in centre or a way centre. Then there's primary care, who were different GPs were operating in different ways, but only urgent referrals were being sent. So that might be a 2-week referral for a certain cancer. But in terms of urgent, does the average GP understand when an urgent rare disease referral is required? So getting an appointment might have been difficult, then being seen face-to-face, and then having any necessary referral. And this is all within the context that we know that often rare diseases present over time with sometimes vague symptoms that really need someone to be seen regularly. You know, if this doesn't go away, please come back. This, which wasn't happening during this time. So then referral to secondary care, I was talking about referrals to genetics in some places really, really dropped off. Requests for first-line testing dropped off in sort of April, June. And then in terms of secondary care, tertiary care, and appointment availability, being able to see people face-to-face has not necessarily been an option. So these are just some of our first line findings. I think more for this theme than the other two themes, it's going to be time will tell, and that's why it's really important that we repeat this process. And I also want to really stress that it's not all negatives. A really important part of this is to look at the risks and opportunities that this pandemic has posed. I'm sorry about the doorbell. There's lots of birthdays happening at the moment, so I think it's Hermes or something. So it's risks and opportunities have been found. People have adapted, services have adapted. And in a way, some medical professionals, it sounds like they've been able to break out their usual roles and be able to take on more. There's a case study of a clinical geneticist who really went above and beyond because she wasn't sure that her patient with a new diagnosis was going to get the follow-up and the management plan that they required. And so I'll stop there because I don't want to keep going on just about theme one, but the risks are certainly there, but the opportunities are there. And I think one of the opportunities for diagnostic delay is certainly how we do look at the old normal of the Odyssey and how breaking down barriers and creating more dialogue between different services and in sort of social care, but also within primary care, secondary care, and with allied healthcare professionals could, in the long run, help reduce the diagnostic odyssey. So I will move on to my colleague, Rebecca, who will tell you about theme 2.
Hi everyone, I'm Rebecca. I am one of the co-founders of Rare Revolution magazine and also the patient support group Teddington Trust, which supports patients with xeroderma pigmentosum. Our theme looked at the impact of health and social care, and we sort of broke that down into technology, access to health and social care, education, attrition of NHS services, and the impact of funding for patient groups. And Lara has so very eloquently demonstrated, some of the findings that we found. So if we look at technology first, we really wanted to understand have a clearer picture of where the benefits and the limitations of telemedicine were. Telemedicine is something that within the rare disease community we've been advocating actually for quite a long time. And I think it definitely demonstrated the benefits of that. However, that didn't mean that there were no limitations, and certainly from a healthcare professional point of view, even in one situation we spoke to a consultant who had been really excited about the acceleration of telemedicine and video consultations. He was really disappointed. So in dermatology, he found that actually what you could see on a video call was not enough to have a really good understanding of what they were looking at on the screen, even with photographs and with, some really good high resolution phone cameras. It just wasn't enough. You couldn't see enough of the area to really tell. And the other side of that was the holistic approach. So getting those, nuances and body language that you would in a person-to-person situation to see how someone is, that was very difficult, and they found that a limiting factor. I think as well, privacy is a bit of an issue, as all of us who've been on a Zoom call know. Stopping people, small children coming in, animals climbing over the top of you, people being able to find privacy in their homes to have consultations without interruption. I think that's another limitation that telemedicine holds, but certainly lots of people find that for the bits that could be done over the phone and could be done through video, that was definitely a benefit. Access to health and social care, really, as Lara's demonstrated, treatments were either deemed elective or non-essential and stopped, having a huge impact on the patient community. There was no protocol for patients who had a rare disease and then got COVID for how that they were to be treated. And I think there was also initially in the early days a lot of worry over ventilator use and who would be given priority on that when there were shortages. So these kind of anxieties and worries also played into the fact that whether you were asked to shield or not, your disease might not have put you at an at-risk for shielding. But then if you got COVID and you went in and suddenly there was going to be a decision over whether you would get a ventilator or not, that obviously was an additional pressure. Services that were physio, speech and language, occupational therapy, the stop of all of those has definitely had, undoubtedly a detrimental effect on patients. Both the patient community and consultants have got real concerns over patients that have lost those services, neurological patients, patients that require physio, definitely seeing a decline in their conditions over this period because of the stop of those services, and also that support for patients. If you're not getting that respite care, those day centres not available, the impact on carers has been huge. I think the other story that Lucy alluded to with the stay at home is that the message now is that many consultants are saying hospitals are open, but we're definitely not finding that that is trickling down to all primary care. And so that referral process still being difficult to be seen, and patients trying to now access healthcare, but being told that they can't. So another, big block for patients with rare diseases. Education, absolutely no SEND support for families. That's been massive. No back to school guidelines when the schools did reopen was also another huge problem for patients. And in fact, we spoke to Birmingham Rare Disease Hospital, and they said that if they had had a dedicated support line just for people asking questions about whether their children should go back to school, they could have filled it every hour of every day, the number of calls that they received asking those questions. So I think for patients knowing whether or not they should be going back, sending their children back to school, there was just they just found it really difficult to find the answers to that and find support there. Attrition to NH services was another thing, and I think this is something that the full picture won't be seen for many months and probably well into next year. The closure of units to provide space for patients and because staff were redeployed. But what we're seeing is that the reopening of those is quite slow. And when they are reopening, people are permanently finding that they've lost staff. There seems to be a budget squeeze that hadn't been anticipated. And certainly from one consultant that we spoke, he'd permanently lost staff due to budget cuts. We also have the problem of the loss of expertise, where medical professionals have very sadly died from COVID-related illness. And losing that experience and expertise in rare disease is obviously a huge problem when the amount of professionals that work in the space is really small anyway. And then there is the funding of patient groups. So again, Lara demonstrated in her situation the impact on patient groups. The demand for services has been astronomical, where medical services have dropped off because of COVID. Patient groups are picking that up and support groups are picking that up. So there's never been a greater demand on their time and on their services. But at the same time, overnight, most had a complete loss of funding. However, what we have seen is huge innovation in the area. The speed at which patient groups have pivoted to provide online services and look at other mechanisms of funding has really been incredible. And I think there is there's a model there that for anyone in the space to look at and see how they did it. It's been a huge positive. And again, as Lara said, I think that will be something that patient groups will take forward as a huge positive now that they've done that work. But the toll on patient groups, both in funding and to their staff and their volunteers, of managing that workload and also managing the worries of their communities. Again, something that shouldn't be underestimated. So I think there's a lot of work to look at in the long-term impact of everything that has happened within COVID on people's well-being and mental health. And again, as Lara so kindly shared, that impact of doing things alone, doing things that you wouldn't normally be expected to carry out on your own, the isolation that patients are feeling is going to have an impact, you know, well into next year and beyond. So that's kind of our very high level findings from section 2. Again, it's not a rosy picture, but there are certainly some key positives that we can take forward, but lots to be considered. And I shall stop and pass on to Jo.
Thank you, Rebecca and Lucy, who came before. I'm Jo, the Managing Director of Cambridge Rare Disease Network, and I had the honour of overseeing this final theme, which was a combined theme looking at real-world evidence and clinical trials. We had a really vibrant group contributing to this, 15 individuals who were representing pharma industry, data collection managers, healthcare professionals, and of course, patient groups. I think we of all the groups found the challenge of actually finding out what the real picture was the most difficult. We began by searching the government clinical trial websites. We were looking to see how many rare disease trials were in progress, whether they were, you know, almost at the end of their journey at clinical trial stage 3, or whether they were very early stage, looking at natural history. And whilst we were able to do that and to extract that data, what we weren't able to do easily was to find out which ones had actually been impacted by the COVID situation. So we then had to find a more creative way of getting this knowledge. And we ended up interviewing in quite a lot of detail 20 different organizations. So we reached out to some pharma companies, some biotech companies, organizations involved in collecting real-world evidence, and again, medical research charities who were focused on rare diseases. And from these 20 detailed interviews, we were able to kind of get a bit of a picture of what was happening. And just in summary, I would say that there were very few trials or collections of real-world evidence that weren't impacted. Like the other two themes, we found that all of those sort of issues around lockdown and patients not being able to access their healthcare providers, it brought things to a grinding halt quite dramatically. So in terms of clinical trials, it was the trials that were in early stage development that were affected most. And that was largely because recruitment was very difficult. Patients weren't able to see their physicians in person, and they weren't easily able to visit trial sites. We even had specific examples where physicians were not able to provide a paper survey to collect that initial information because they were worried about cross-contamination and safety. So things ground to a halt, things were slow to restart. That was the second issue. But what we did see, and sort of trying to draw out the positives from this, was some really innovative solutions to how we could move forward. And I think these are the really important aspects that we're trying to capture for the future. So what can we do differently, I think, is the big question. What have companies and organizations and trial sponsors begun to do that really the rare disease population would like to see kept for the future? And some of those ideas I'll share with you now before we move on. So we're looking at things like home visits. So where organizations could be creative and they could collect the evidence that they required through a specialist nurse visit to the home, things were able to continue almost seamlessly. Validating digital endpoints was another thing that was flagged. Decentralized and hybrid trials seemed to be something that pharma companies have been able to adapt to quite quickly, and it's something that rare disease patients would value for the future. Using e-consent, so that issue of having to worry about the cross-contamination of a paper form becomes irrelevant if e-consent can be sought. We're also looking at ideas which would allow patients to capture evidence themselves at home. So using video to replace some of the trial sites, allowing research to continue during not just pandemic situations, but also where it's difficult for a patient, often patients scattered around the world, to reach their trial site easily. We're looking at biomarkers that can be measured at home by patients, carers, or technology. The idea of using technology in health wearables has really come to the fore, and there are already some really dynamic and exciting companies, I believe, that are going to be taking part in this Find a Cure event over the next few days, who have been capturing this evidence by allowing people to do that wearing a health wearable. I think the important thing that we want to get across is that whilst the situation has really put rare disease trials on a back foot and has slowed down the process, we've been always adaptable and innovative in order to try and move things forward quickly and find new solutions for the future. And I think that's something we really need to be proud of as a community and to harness.
Okay, thank you guys so much. It's fantastic to see the work that I've been doing over the past months, and I've had a small insight into some of that work, and the challenge of getting such a large sprawling collaboration moving and has been really a tough one. I want to give credit to all three of you for that work, and to see some of the findings and outcomes moving forward so nicely is brilliant. I just wonder if we can very briefly, I don't know if Joe or Rebecca or Lucy would like to comment just on what you see as the next major steps and the outcome that we were hoping to get in the next few months with the work you've been doing.
I think the next major step, certainly for the three individual themes, is to pull together everything that they've done. So we've been doing a huge amount of work in collecting evidence from different organisations, interviewing people and so on, but also collecting data. And we've got quite an onerous task now in terms of pulling that all together and creating succinct and summarised documents. But the intention was always to be able to gather everything together, create that document, and then share it not just with our own community, but with policymakers, the government, those in charge of developing the new rare disease strategy for the UK. And to have this on a virtual platform which is accessible to all, really to learn from and to move forward from.
And I think this is really keen. It's definitely something that I'm championing quite a lot, but we'll take the money. Is everyone here will be fed up of hearing about it. So I really want, personally, I think this really needs to be on a virtual platform that grows, because COVID, as we know it, is not going away. The long-term effects aren't going away. We need to repeat this exercise. It needs to be accessible, as Lara was talking about in her talk. And while certainly a list of recommendations is required, I think that different people are going to want to take different things from this. And also it's really important that those who have a rare disease, and this is meant to represent their experience, can have a look at it, add to it if they wish to, or and etc. I'd also say, if there's any like the study that you did, Lara, if there's any sort of studies that you know of, good case studies, or anything that you would like to bring to the Ardent table, first of all, you're welcome to just join us. This is like an open collaborative group. And also, but if you don't have the time, because we know everyone's really busy, but you want to make sure that information that you know about is included, just send it to one or all of us, and we'll see, and we'll try and, you know, amalgamate it all together, collate it together.
Brilliant.
I'd like to just add very quickly, Rick, about the collaborative nature of this. I think that what this has demonstrated as a pilot, if you like, is that we can successfully bring in all of that cross-sector community to work together. It is the first time I've seen it done at this scale in the short time I've been in within rare disease. It's something we've tried to work hard towards a lot, and it's very difficult to manage. So I think as a future for Ardent, it could be a place where, you know, it isn't just here for COVID, it's here to tackle some of rare diseases, bigger problems, and it's a collaborative platform to allow everyone to do that in an environment that they feel safe in.
Yeah, absolutely, guys. You've done a huge amount of work to make it happen, keep it moving, and I'm really excited to see what comes forward from it. So thank you for your work, and thank you for sharing it with us. I think what we've just seen, everyone, in those last two talks is a perfect kind of encapsulation, first of a case study in a specific rare condition, highlighting that impact that COVID has had on individual people and individual communities. And then moving on through the Ardent presentation to really see that bigger picture and the scope and the sweeping impacts that we've seen across the sector, whether that's within the smallest patient community right through to the impacts on clinical trials that industry are running. This is clearly an unprecedented time, but in all of those presentations and everything we're hearing, we're seeing examples where the rare disease community are finding ways to keep going, to move forward and to deliver something meaningful to the patients. And that's hopefully what we're going to be trying to highlight and celebrate through the rest of the showcase. So with that, I'd like to move on to the last speaker in this webinar session, and a slight leap in theme. So I'm going to welcome Katrina Crombie from LifeArc to the stage. Katrina has worked with us a few times in the past at Findicare, actually, and at LifeArc, they are absolutely focused on translational research and how we take projects from a preclinical space and move them actually to a stage where they can begin to make an impact to patients. Now, those of you that know Find a Cure well will know that I've been hammering on about drug repurposing for 5+ years as a really great route to try and drive things forward in rare diseases. It's a type of research that theoretically at least should require less time and less funding to get it moving and get it to the point where we can start dosing patients and therefore begin to see if we're seeing an impact. And I think it's therefore a really interesting route to pursue to drive forward more quickly the development of treatments, particularly in collaborative projects, maybe outside of the industry space, the traditional route, if you like, of drug development. Now, I like to think I've made a little bit of a noise about this, and we've moved some things forward. And I know LifeArc and Katrina have been working and thinking about repurposing in rare diseases for a while. But what we have all seen undoubtedly during COVID-19 is a sudden rise in the prevalence and precedence of drug repurposing, primarily as a route to try and develop new treatments for COVID itself. And it has been a route that's been very successful. And what Katrina is going to talk about, hopefully for us now, is the insights and the work that LifeArc have done in the repurposing space, the work that's happening to drive forward new treatments for COVID through repurposing, and what hope and ideas it can give us to help drive this sector forward for rare diseases in the future. So Katrina, welcome, and thank you so much.
Thanks, Rick. Yeah, as Rick's just said, he has asked me to talk a little bit about what LifeArc have done with repurposing, specifically in COVID. So I'll talk a bit about that, and then I'll move on to a little bit about what our day job has been in the rare disease space pre-COVID, and what we are hoping to do to enhance the prospects for repurposing moving forward. I want to give you hopefully a balanced picture of how hard repurposing is, as well as what the great opportunities are there. And so I will hopefully, if at all possible, share my screen with you. Where is it? There it is. Let me see if I can. There. So as Rick said, I work for LifeArc, and we are a charity that focuses entirely on translational medical research. So we work with a broad range of groups, including other medical research charities, academic research organizations, industry, and a huge spectrum of people. We are self-funded through revenue that we have managed to generate from getting drugs licensed on into pharma and marketed to patients. And so we get small royalty returns from those drugs, which allows us to function as a charity. And we are very much focused on bridging that gap between getting stuff out of the academic space, capitalizing really on that early research and moving it forward to commercial routes to patients. And we do that really in three ways. We offer a lot of translational advice. We started off as an organisation supporting the UK's Medical Research Council with their technology transfer, and essentially everything that we do has grown out of that advice activity. So we protect intellectual property on behalf of a number of clients. We provide advice and support to scientists who want to translate their findings into impact for patients, and provide advice on how you get that stuff right the way through to market, and what the routes for doing that might be. We also have our own research laboratories. So we provide those labs to help to do the hands-on science that's needed to build the data packages that are required in order to move projects forward. So we have a drug discovery operation that is based up in Stevenage, and they have expertise in small molecules and antibody development. We also have a facility up in Edinburgh where they do diagnostics development. So they take in projects again from the academic space, do the work that's needed to get them to the point where a commercial diagnostics manufacturer will be able to then take them forward. We also provide translational funding. So one of the reasons that I was recruited into LifeArc was to set up a grant giving scheme to help support rare disease research. So I'll talk a little bit more about that as we move forward, but we also have a number of other funds that support early companies and work in the sort of venture space as well. So in March, as we've all been hearing in this session, COVID-19 hit and provided us with one massive distraction that slightly distracted us from those day-to-day activities that we were doing. You don't need me to tell you that COVID-19 has had a massive effect on everybody around the world. We have now seen over 1 million deaths as a result of COVID. So back in March, we were having conversations and saying, well, should we as an organization be doing something about COVID-19? Should we be looking at what we as an organization specialized in translation can do to help the world with COVID-19? And in thinking about this, the position that we really sit in the drug development pathway is kind of round about here in the very early stages. And for a classic, new drug development program, you're looking at 13 years to get to patients. That's a huge length of time in a situation that we find ourselves in at the moment. So we thought that drug repurposing might offer an opportunity to get drugs available to patients in a much more impactful time frame. So, with a fair wind behind us, I think we thought, what's happening to my slides? That we might be able to get results to patients within a sort of a year time frame. So that was why we thought that we would focus our efforts, at least initially, on drug repurposing and hopefully be able to deliver some impact for patients. So as Rick has alluded to, we've talked about drug repurposing a number of times in the past, and there is a huge opportunity to deliver drugs to patients with repurposed medicines where clinical trials have already been done and there is a good data package available that would allow us to get drugs through at a reduced cost and hopefully quicker, and and with fewer safety concerns, or at least, you know, with a drug where you know the tox profile, you know what the potential safety and side effects might be, and hopefully where you already have a manufacturing setup. So you would be able to get drug available and out to patients reasonably swiftly. So in March, we launched a £10 million fund to support projects that are looking to test drugs that are currently available. So those are either drugs that are licensed already for another indication or in very late stages of development for the treatment of COVID-19 patients. We were totally overwhelmed by the support, the enthusiasm for the call, and the number of people who had great ideas for projects that could be done reasonably quickly and could potentially benefit COVID-19 patients. So we had over 130 applications that we considered were in scope. And they came from a range of different groups, academics, hospitals, companies, and from countries all around the world. And for drugs that were both off patent and cheap, and, you know, potentially expensive, already owned pharma assets, or generic drugs, or even cell therapies. We put together an independent scientific review panel, and at the end of May, we were able to announce that we were funding 15 clinical trials of repurposed drugs. So to go from, in just over 2 months, from having had no idea what whether we could do anything for COVID-19, to having trials launching and money out the door, was quite an achievement that was thanks to a huge range of people at LifeArc who all pulled together to deliver a huge amount of work to get that done, and a fantastic scientific review panel that came together at really short notice to do a huge amount of work and pour through a lot of applications and help us to prioritize them. The brilliant thing about our panel was it's not only some very influential people, but they had a very diverse set of backgrounds. We had experts there who are experts in the virology, and experts in immunology, clinical experts, those with trials, stats experience. So it was a fantastic panel that gave us a really good confidence that what we were supporting was worth supporting. And yeah, thanks to all of them for their fantastic hard work. The criteria that we used for deciding what projects we would fund were reasonably straightforward. The first and foremost thing was looking at the scientific evidence. What is the justification for testing these drugs? Why might they work in COVID? Obviously, the science around COVID is a moving feast, and we've been learning all the time, and we had to make decisions with the best information that we had at the time. But that was the first thing that we were looking at. We were also looking at whether you could get access to product. Was this drug going to be available? Would we be able to get it to patients in a timely fashion? We looked at the uniqueness of the study. So if other people are doing a study, what would be the added value of us also funding a study? Was there a need for there to be multiple studies joined together? Could the study be delivered? Now, I think that was a very difficult question, and one that we really only finding the answers to now, and some of the trials are easier to deliver than others. And really, we were looking at getting results as quickly as we possibly could to make an impact in this condition. So what we ended up with was that we were funding projects that covered the whole spectrum of the COVID-19 disease, from the early prophylactic stages, where we are funding a couple of projects with particularly high-risk groups. We're co-funding a couple of those with other medical research charities, such as Kidney Research UK and Cancer Research UK. We also looking at early interventions, and then hospitalized patients, and how we treat those with more advanced disease. These are the initial indications that a number of the drugs that we are studying were originally developed for. Now you'll see that they cover quite a range of things, and some of them are targeting symptoms of COVID-19 that some of them were originally developed to tackle things that are now symptoms of COVID-19. So for example, the anticoagulant drugs are tackling the coagulation symptom of COVID-19 rather than being completely different indication, but we're also testing drugs that were originally developed for breast cancer or tapeworm infections, which are completely different indications. So going back to what I was doing previous to COVID hitting, I support a fund called the LifeArc Philanthropic Fund for Rare Diseases, and what we do with that fund is specifically support translational medical research that will benefit rare disease patients. So projects to develop therapeutics or diagnostics for rare disease patients. We award grants to academics, and we either do that on our own or in partnership with disease-focused charities. We don't look for any financial return out of any of this stuff, but we really are focusing on trying to de-risk these projects in order to incentivize someone to take on the onward development. Now we've seen a number of projects coming forward to that fund in the rare disease space. We've also seen that a number of our charity partners have a number of potential drug repurposing projects within their portfolios. Now, if I talk to my colleagues at LifeArc who've come from a pharma background, and I talk about drug repurposing, they all go, oh, can't be done. It can't be done. It's too difficult. It's too complicated. You've got no intellectual property. It can't be done. And that's probably, hopefully, not true, but it is difficult. And there are lots of challenges, that repurposing present us. If you have no intellectual property, it is very difficult to carve out an exclusive market and incentivize someone to take that forward. Of course, if somebody else owns the intellectual property on the drug that you want to test in your patient population, then you don't have any legal right to do that. So intellectual property can be a huge challenge. There are huge economic considerations if you are looking to convince somebody to fund a later stage, a large scale clinical trial. And if they don't think they can get return on that investment by having some level of market exclusivity, then it can be a huge challenge to convince somebody to pay for that. If the data on the safety of the drug exists only within a pharma company, say, it might be very difficult for you to be able to gain access to that data in order to convince a regulator that the drug is actually safe or is going to be safe in your patient population. There's a lot of people who think that off-label prescribing is the answer within repurposing, but that's not necessarily, it depends very much on what the drug is and what the indication is. But convincing a doctor to prescribe something off-label can quite often be difficult. There are liability issues for the clinicians involved, and you also want to convince somebody to pay for it. So sometimes for cheap generic drugs, getting someone to pay for it might not be so much of a challenge, but for more expensive antibody drugs, say, getting reimbursement is very difficult. You need market authorization if you're going to take something to NICE for evaluation, and if you don't have market authorization, you won't be able to do that. So there's huge challenges there. Convincing somebody to go for market authorization is, again, not trivial if there isn't the prospect of financial return. There's a lot of costs involved in maintaining a market authorization, and the holder of market authorization has responsibilities for long-term patient follow-up and things. So it is a significant undertaking taking on a market authorization. You may also have challenges with getting drugs available. So I don't want anyone to think that drug repurposing is necessarily simple or straightforward, but when we at LifeArc were looking at this, we look at all of these problems and think, actually, most of these are solvable problems. There may be ways around some of these things, that may require us to think slightly outside the box and may require us to work with partners that we haven't thought about working with before. But if we can solve some of these problems, we may be able to move these drugs through and towards patients. So before COVID hit, we had started to do some work around drug repurposing, really with using our IP expertise and the knowledge that we have of the translation space to work out not only to kind of catalogue what the challenges are, but how we might go about solving those. And there's a real enthusiasm, I think, across the community to try and work out solutions for drug repurposing. I think there is a feeling that if there is a drug out there that might work for a patient population, then to simply say it's too hard and there's all these barriers in the way is just not good enough for patients. So, there are a number of charities working in this space, including Find a Cure, who've been doing a lot of work, and the MRC have also published policy papers suggesting different ways that policy changes might enable repurposed drugs to be more accessible to patients. We've spoken with a number of the regulators, including MHRA and NICE, and there is enthusiasm on their behalf to look at how we might enable drug repurposing to happen in an easier way, or to streamline that. And the NHS is also very enthusiastic about the idea of getting cheaper drugs available to patients. So I think there is some real enthusiasm across the community to enable changes to happen that will allow drug repurposing to happen easier. But I think as a charity, we thought, right, I think all of this policy change is great, and we're very supportive of trying to change the environment in order to enable drug repurposing. But today, we live in a world where there are systems in place and processes in place, and we need to work out what the route forward is for a particular drug within the confines of the system as it is right now. And so our plan at LifeArc is to really put together a toolkit for charities and academics to kind of work out how you might move a drug through to the point where it's available to patients. How you might incentivize someone to take on the later stage testing and get that market authorization. What might the financial incentives be? Are there routes to where you can get that market exclusivity that pharma and investors are looking for? Either through IP, is there a way to create a new IP package? You can use things like orphan drug and pediatric formulations to get some level of exclusivity through a regulatory route. It might be that you can do it by combination drugs. There are different things that we've been exploring that might work for different drugs and different indications. So I think what we would like to do is to pull all of that work together into some form of toolkit. Now, we had kind of started doing that before COVID hit, and I'm afraid all of that work got paused as we dealt with the consequences of COVID and delivering the trials work that I've been talking about earlier. We have a plan to have a workshop for charities early next year. We haven't yet got a date available for that, but if you kind of watch out on various channels and our website, hopefully we'll be announcing that in the not too distant future. And I'd really just like to end with a bit of a kind of an appeal, if you like. If you think you have something to add to this piece of work that we're planning on doing, then please get in touch. But likewise, if you think that you have a drug that could be repurposed for your indication, then please also get in touch, and we may be able to help you to think through the problems and the challenges of repurposing that particular drug for your particular disease, and what routes we might be able to come up with that may help to navigate the system as it is today and move that drug through the development path towards the patients. If you think at all that you can help us or we could help you, then please get in touch. I think my email is there. And with that, I shall hand back to Rick and stop sharing my screen.
Thank you so much, Katrina. That was great to hear the work that's been going on, both COVID and drug repurposing, and obviously music to my ears when I hear someone else talking about the fact that it's not good enough for us simply to say that we can't do repurposing. It's just too hard. We have to find a way to help patients so there is an opportunity to find a treatment for the huge unmet need that's out there. So thank you for that. I just wanted to ask you briefly, we have seen a lot more media attention, particularly around the successful moves to repurpose treatments for COVID. Do you think or foresee there being a kind of groundswell in that support for repurposing in rare diseases moving forward? Or how do you think that might impact things for the broader repurposing space of what we've seen in this year?
Yeah, I mean, I think the success that we'll see with COVID is going to open a lot of doors for the potential for drug repurposing in a huge range of other conditions. And it is going to be putting it at the forefront of policymakers and those who set the regulatory framework. So I think there is a real opportunity. I think the door was slightly ajar that we were pushing on before COVID hit. There was a real enthusiasm by a number of parties to really engage in how we might make repurposing a reality. But I think that door is now much more ajar, and we just need to keep shoving on it, and hopefully we will see an impact. But what I'm keen to do is that we can operate in the world that we're in at the moment. We can find a way through for these drugs that can benefit patients.
That's fantastic. Thank you for that. I appreciate it. So in the last few minutes, I'm just going to go to a couple of questions that I've seen fed through from the chat. So thank you all for posting those. And the first one came in, I think, from Mike Kane, just touching a little bit on the role of GPs and primary care in the diagnostic odyssey, and I guess primarily directed at Lucy and the guys from Ardent. But how do you see the role of GPs fitting in trying to break down this diagnostic block, and what do you think the impact of COVID has been on making their life harder and easier to tackle this?
I think this is an ongoing, so in terms of the diagnostic odyssey in totality, so if you don't know Medics for Rare Diseases, then we're about driving an attitude change towards rare diseases within the medical profession in general, but targeting medical students and doctors in training. So we're really focusing at the very base level that education about rare diseases has to be there in the first place, and also continue through continuous medical education, which would be one point about then preparing GPs to be able to know when they are seeing not a specific rare disease, but when to suspect, hang on, this patient might have a rare disease because they've got this, and this. I mean, this is a much larger conversation that I love to have with people, so feel free to message me. But then also you can, I believe that Rudy from Mendelian is doing a talk about digital pattern matching, and there's other talks coming up about how GPs can be assisted in terms of diagnosis. But I think within what we've taken from Ardent, our work within COVID, and not just on Diagnostic Odyssey, but my feeling on this is that when your GPs are not necessarily prepared or empowered to manage people with rare diseases, and essentially when you get that kind of tug of war between, oh, it's so rare, the specialist deals with it, but then the specialist may only see someone once a year, and actually the GP knows their family and the area and more holistically, and that if patients fall through that gap, then one of the things that obviously came up was shielding and who decides who's at risk, and that came down to GPs. And so I think what COVID has highlighted, whether someone's got a diagnosis or not, the idea that rare diseases aren't for GP land is obviously not the case. And also, like I said in my talk, I think that opening up of conversations seemed to happen so quickly, and was brilliant to watch, where people, rather than waiting for advice and how referrals could be made and who paid for that certain services, changed quite quickly, so that we didn't have to go through the usual pathway. I would love to have my colleague Will Evans on here, because he's a GP in Leeds and knows a lot more about this. So feel free to message me.
Thanks a lot, Lucy. And obviously, Lucy's running some different sessions throughout the showcase where you can talk a bit more about GP engagement and doctor engagement with rare diseases. So do check that out if you want to learn more on that. Super briefly, there's another quick question that came in talking about different ways to engage people who are really hard to reach at this time. And Lara, I think you just touched on some of that with the work you were doing with the translations with your conference. I don't know if there's any kind of quick top tips you might have for trying to reach those kind of very disparate, hard to reach parts of your community that you might be following at EDS.
Yeah, so I think particularly the kind of virtual support calls I mentioned, and always giving a virtual option for events, even when we're back in person. And then that translation piece, because it's so often the case that both for patients and health professionals, the conferences are presented in English. And so we're, in 2021, we're translating into Mandarin, into Urdu, into Arabic. We're really diversifying the language options there, because I think it is so, so important. We know without doubt there are people living with EDS and HSD in these places. They just A, may not know it, or B, do know it, that a diagnosis is all they have and they have nothing more, and they can't even watch videos and read papers about it because they're all not in their language. So I think that's a really easy, but may I also say expensive thing to do. We have been blown away by the cost of translations, especially live translations. There are some free resources out there, but we've found when we have used volunteers and had them checked by native speakers, there have been issues. And so when you pay for a service, you're also paying for kind of a disclaimer and an insurance to say, we've done what we can. This is down to the translation company, who have taken responsibility to get as accurate as you can. And I mean, it costs around £7,500 per event to translate into 5 languages. And we're doing 7 events next year. So you can do the maths. It's a very expensive process, but well worth it. And there are grants available for that.
Thanks so much, Lara. That's amazing. Well, guys, we are just a minute over time now, so we're gonna have to wrap up this session. I just want to say thank you to all of the speakers. It's been a really engaging session, some great talks and great points, and thank you for everyone who's interacted on Swapcard online. I've really appreciated it. So thank you all for your time. Please now take a quick moment to grab a cup of tea and dive into one of our breakout sessions, which will be starting, I think, at 12 o'clock. And we'll look forward to seeing you then, and hopefully some more of you in our networking talk later at lunchtime. So thanks all for your attention.